Now, in our first story, the Akakpo Health Center in the whole municipality in the Volta region is currently housed in a two-room apartment on the outskirts of the community. The facility lacks space to operate and essential equipment to offer the best health services. Correspondent Fred Kwame brings us more.
The Akakpo Health Center receives not less than 10 clients a day for various health services. The under-equipped facility provides OPD, maternal and child health, and other essential services. There's only 2 rooms available, hence health workers are compelled to squeeze the available space to deliver healthcare services.
We don't have a place for delivery, it's just a chamber and hall that I have personally demarcated, where we have place for detention, but it's not a comfortable place, it's not spacious enough that when people can, they'll feel comfortable. So the whole facility we need a bigger facility. Then we need a place for delivery, and then delivery bed, because currently as a midwife, there is no bed for delivery. So we use the normal bed at a time, or I have to use a mat to conduct deliveries.
Nonetheless, a whole Central National Democratic Congress parliamentary candidate aspirant responded to the distress call and donated 2 beds, 2 wheelchairs, and 2 strollers to the facility. Raphael Koda said the initiative was part of his bigger plan to improve healthcare delivery in the whole central constituency.
Now, there's a community of 5, and this chip zone actually serves the entire 5 communities. So there is nothing. And I came for an assessment, looked at it, and realized that at least I can support. Because they do deliveries, a lot of deliveries. Mothers come to the hospital, to the chip zone, and there's not even a single anything. At least impacting a community is what leadership is all about. If we can do this across board, we'll make life better for all of us.
He hinted at introducing policies to improve the economic status of constituents when elected into parliament in 2024.
The unemployment rate, which is increasingly becoming a threat to us and in the whole central, is a concern. My message to the youth is to provide sustainable jobs, job opportunities for them, so that they can be economically independent. Within the next term, by the time my term ends, at least about 200 youths should be economically independent to be able to support them, their families, and at least extend a helping hand to 2-3 more people. And that will help us to reduce the unemployment rate in the West Central constituency.
Fred Kwame, Joy News, Akakpo.
Now, the Tamale Teaching Hospital has directed the Northern Electricity Distribution Company to chase government for a bill of 46 million Ghana cedis. NEDCO was at the hospital to recover debt owed the power distributor. Now, during the engagement, the hospital's administrator, Emmanuel Donko, said the hospital did not have the power to alter the government or NEDCO agreement.
NEDCO, since the 18th of April, began an exercise to recover its debt of 1.2 billion Ghana cedis. The target of the power distributor is to recover at least 50% of its money owed. It is on that premise that NEDCO, led by its managing director, Osman Ayuba, were at the TTA to meet with hospital management to dialogue on their debt. But the hospital administrator, Emmanuel Donko, said the hospital does not pay electricity bill from its coffers.
As a matter of fact, we as an institution, we do not pay for electricity from our coffers. We don't do that. It is being paid for by the government. And as far as I'm aware, I think last month or so, we were asked to forward our bill, and we did say. So the thinking is that this figure that you have even mentioned, this will be more than that. So practically the government had defrayed portion leaving this figure right now. It is our expectation that now that you are carrying on these exercises, government will see the need to defray the debt for us to continue to enjoy your good services. For now, I cannot say for a fact that the government would reimburse the money today or tomorrow.
Staying on health-related matters, the Ghana Health Service says punitive measures are being taken to address the increasing number of legal suits against its personnel and facilities. Health Minister Akakpo Menu, at an ongoing senior managers meeting of the Ghana Health Service in Kumasi, expressed worry at the increasing spate of litigation in the health sector. But the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, tells Ohiming Tewe of our health desk administrative sanctions are taken against staff whose conduct affects the service negatively.
According to Health Minister Akakpo Menu, the increasing number of lawsuits against health professionals in their line of work in recent times is worrying. He observed some cases were recorded when he joined the ministry 6 years ago, but the number has shot up in recent times, almost becoming normal for health professionals and facilities to be sued for negligence.
What I'm seeing of late in the ministry are issues of litigation. For the past 4 weeks or so, almost every week, we get at least one letter from the Attorney General's office. Somebody has sued somebody with problems with care, service delivery, and they want us to come with information for them to go to court with. Then we'll refer to Director General Kumabwaji. But I've been with you for the past 6 years. Earlier when I came in, those things were not happening that much. But now it's become something, it's just climbing, it's becoming very common.
But the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, says steps are being taken to address the issue. He tells Joy News erring personnel are made to face punitive actions as part of the service's quality assurance controls.
There are some that we can have, that some negligence that has been. That's why I said those ones, the administrative sanctions are applied, and those who need to be trained, who need to be corrected, are corrected. And this is part of the quality assurance system that also helps. So we are not against people who feel that they have not been treated well. Sometimes they also don't understand our protocols, and it's not as if we lose every case. But there are some cases that once we do further explanation, people understand. So that's why it is. I see it as a more of a positive sign that allows also us to set up.
Dr. Kumabwaji believes the introduction of training for health workers, among other measures, would go a long way to improve the situation.
For me, this litigation is a good sign. People are understanding their rights. They are demanding quality, and there's nothing wrong with people who feel that they've not been treated well to take up an action. We have a system, we continue to do training, we continue to encourage people not to do the wrong thing, we continue to people to be professional, and we believe that that one is there, but because also people have become a bit more enlightened, it is important. It's going to help us shape health delivery services that we have. We have a legal department that works with Attorney General to ensure that all those things are addressed, and where we feel there's a defect, appropriate administrative sanctions are taking place, training is taking place if we feel that some standards were not met. So that's how it's an ongoing process.
From Kumasi, for Joy News, Ohiming Tewe reporting.
On health once more, Ghana has no documented child death related to measles, though the country experienced an outbreak during the period of a vaccine shortage. That's according to the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, who is commending health workers and partners for the successes chalked. Ohiming Tewe of our health desk has more in this report.
Ghana experienced a shortage of childhood vaccines between 2022 and 2023. Within that period, the Ghana Health Service announced an outbreak of measles, one of the 6 killer diseases among children. Oral polio and measles vaccines, among others, were in short supply in child welfare clinics across the country. Frustrated mothers jostled between home and clinics in search of non-existent vaccines for months. But speaking at the African Vaccination Week launch in Kumasi, Dr. Kumar Buaji said Ghana has no record of childhood deaths associated with measles as the country reaches the elimination stage. He commended health workers and partners of the Ghana Health Service, including the World Health Organization and UNICEF, for their commitments towards a reduction in vaccine-preventable diseases.
Ghana can confidently boast of achieving the following immunization milestones. Over 90% coverage for almost all routine vaccines in the country. That is 9 out of 10 children are fully vaccinated. The proportion of fully vaccinated children, that is those aged between 12 to 23, that is 1 to 2 years, has improved from 47% in 1998 to 77% as of the last demographic and health survey in Ghana. That was almost 10 years ago. We believe that the figure is even much higher now. There is no documented child death due to measles, and despite the outbreaks that we had a bit of last year, there's still no death associated with the measles. And the country is in elimination mode for measles control. The country has been free of wild polio virus since 2009, and Ghana's documentation for polio-free certification was accepted by the African Regional Coordinating Committee in 2007.
Meanwhile, WHO's country representative, Dr. Francis Chikasa Kosolo, has called for strong collaborations and investments in immunization systems. He also wants issues related to vaccine hesitancy addressed.
As we celebrate the 2023 African Vaccine Week, we must work together in the spirit of the Sustainable Development Goals to ensure that no child is left behind. This means investing in strong immunization systems, increasing vaccine coverage, and ensuring that vaccines are accessible to all that needs them. We must also address vaccine hesitancy, which has become a growing concern in recent years, especially in relation to our COVID-19 vaccine deployment. Misinformation and mistrust have led some people to refuse vaccination, putting them at risk of the disease.
From Kumasi, for Joy News, Ohiminteria reporting.
That's the end to the bulletin and the start of the news review. Up next shortly. Do stay.